Robotics in urology refers to the use of robotic surgical systems, primarily the Da Vinci system, to enhance minimally invasive procedures for various urological conditions. With time, numerous other robotic systems have come into the market, such as the CMR system, the Hugo system, the Mantra system, etc. Robotic systems offer surgeons improved precision, dexterity, visualization because of magnification and 3D effect. This leads to better patient outcomes. In urology, common procedures such as radical prostatectomy, cystectomy, nephrectomy, partial nephrectomy, and reconstruction of the urinary tract are performed easily with this system. All these systems depend on a master slave pattern, or they are also called online robotic systems, where the robot replicates the surgeon's movements in real time. Currently, the most popular worldwide robotic system is the Da Vinci system, which is now in its fifth generation. Initially, it was called the Da Vinci 2000, then later it became the SI system, then the XI system, and now it is the single port system, which uses Vespa technology. In a typical robotic system, there is a surgeon console, an instrument cart, and the robotic arms. These are all interconnected. Thereby, the surgeon who sits on the console can comfortably look through high definition 3D magnification and use finger clutches to control remotely the robotic arms. The robotic arms are fitted with robotic instruments which enter the patient's abdomen, and these instruments have a high degree of flexibility of motion. This is characterized by the facility of an endo wrist, which gives a greatly increased degree of motion. Along with robotic surgery, laparoscopic surgery has also evolved to a great extent with better cameras, better instrumentation, and miniaturization of instrumentation. The disadvantage of laparoscopy is the patient is at the bedside of the patient. The surgeon is at the bedside of the patient, and he needs to physically sometimes stand in abnormal postures, extend his arms and shoulders, flex his wrists, and the surgery may take a long time. Hence, it can have a result of causing physical harm to the surgeon in the form of tendinitis, joint pains, back pain, neck pain, and fatigue. Secondly, conventional laparoscopic instruments are straight, they cannot be flexed, and hence, in deep in pelvic region of the body, it may be difficult to perform fine tasks such as suturing. Robotic instruments which have endo wrists can bend and make these procedures more easy. Finally, the efficiency of the cutting and coagulating instruments are much better than standard conventional coagulating instruments. This offers better hemostasis and control of bleeding. Robotic surgery allows the surgeon to sit comfortably at the console. He can even take breaks, stretch his arms, have a cup of coffee if needed, recharge himself, and continue the operation. In fact, two teams can operate simultaneously. Thereby, efficiency of the surgery is increased and the fatigue and physical side effects that can affect the surgeon are decreased. Robotic surgery allows the surgeon to sit comfortably at the console. He can even take breaks, stretch his arms, have a cup of coffee if needed, recharge himself, and continue the operation. In fact, two teams can operate simultaneously. Thereby, efficiency of the surgery is increased and the fatigue and physical side effects that can affect the surgeon are decreased. The main disadvantage of the robotic system is its initial cost, its annual maintenance contract, the fact that the instruments are programmed for limited use, thereby increasing the cost of instruments per operation. Finally, many health insurance companies do not reimburse the costs or the extra costs of robotic surgery as compared to laparoscopic surgery. Thereby, patients may be forced to bear an additional cost towards their robotic surgery. Hence, this facility may not be available to the whole world population, especially lower socioeconomic groups, lower socioeconomic countries, and may be predominantly localized to well-to-do societies. In spite of all this, with innovation progressing so rapidly, there are huge advantages of using a robotic system, especially for certain complex urological operations. There are now reports of surgery performed remotely with the surgeon's console being in one country and the robotic arms in another country connected